There are many different ways to consider curriculum planning.
One way, which has been particularly dominant in recent years, has been something called the educational paradigm. This is sometimes also referred to as Tyler's triangle, and it emphasises the importance of the relationship between the aims of a programme, the teaching methods used, and the assessment method. There are lots of things that drive the curriculum, but certainly assessment is an important part.
Assessments help to motivate people, and it's important to design the right assessments when planning a curriculum.
In the 1960s, there was a big move to try to specify very precisely what a programme was aimed at achieving. And this led to an emphasis on behavioural objectives. Now, some professions have continued to include behavioural objectives in their curriculum design. The great difficulty with behavioural objectives is that you have to start splitting things up into smaller and smaller minutiae, and your curriculum then ends up a bit like a telephone book. It's a huge document. The second problem with behavioural objectives is that they're absolutely fine if you're learning a skill, because what you see at the end is a behaviour. But what about all the other learning that happens? What about when somebody changes their values and beliefs, their attitudes? What happens when somebody changes their knowledge, their understanding of something? Behavioural objectives are perhaps not entirely appropriate for that. So, as a reaction to the emphasis on very tiny, obsessional behavioural objectives, the educationists started to feel, well, we do need a sense of direction in our curriculum. We do need a sense of purpose. Maybe we should think about learning outcomes. The move away from behavioural objectives towards intended learning outcomes was definitely a step in the right direction, because it broadened what an educator might be thinking about in setting a curriculum. But in a sense, a major criticism is that this is a very mechanistic model. It sees the learner and the teacher as inside a black box, and all that is of relevance are the inputs and the outputs. Educators have started to realise that thinking about the curriculum, you need to think about what's inside the black box. And that relationship between the teacher and the learner doesn't take place in a vacuum. It takes place in a social, cultural, and political context. One of the things that goes on is the relationship between the teacher and the learner, and inevitably there are power dynamics in that relationship. So it's quite helpful to have a think about how we might consider power dynamics between a teacher and a learner.
Analogies can be drawn with the relationship between the practitioner and the patient.
One way of thinking about the relationship between a practitioner and a patient is transactional analysis that talks about a parent, an adult, and a child. So a patient who comes in to the consulting room and says, "I've been sent home from work," is taking the attitude of a child wanting to be cared for by a nurturing parent. Very often, though, a practitioner would prefer to be in an adult-adult relationship and may need to work quite hard to transform the relationship with such a patient. Another way of looking at the relationship between a therapist and a client was described by de Shazer in the States, and he talked about a visitor, a complainer, and a customer. A visitor is similar in a way to a child. A visitor doesn't want to be there. They've been sent. A complainant is very happy to have a conversation with the therapist, but wants the therapist to sort out all the problems. By contrast, a customer is somebody who wants to work with the therapist, but is taking responsibility for sorting out their own problems with the help and input of the therapist. A third way of looking at the relationship between a practitioner and a patient is to think about locus of control. If somebody has an internal locus of control, they are empowered. They're responsible for their own health, and they are entering the relationship in the consulting room very much in an adult-adult way. By contrast, if somebody has an external locus of control, they see themselves as being blown by the winds of fate. They are not empowered, they don't have control over their own destiny, and they may well turn up in the consulting room saying, "I've been sent home from work." Similarly, in the relationship between a trainer and a learner, it's very important to make an assessment of where the learner is on that spectrum from internal to external locus of control. If you as a teacher really want to be developing an ongoing adult relationship with your learner, you need to set the tone of the relationship early on. And inevitably there will be power dynamics, inevitably there will be things in the relationship that need to be explored. And the way you handle that early on is very important.
There's evidence that empowering learners can make a real difference.
Sackett's group identified 3 important factors that make a difference to how people learn, and they studied the outcomes of that learning in the continuing professional development of people trained in an institution where empowerment of learners was part of the educational ethos. One dimension of Sackett's cube is the clinical problem. If you're just asked questions to assess your knowledge, that isn't a clinical problem, so none. The second stage that improves things a bit better is to present a scenario, a clinical scenario, a case history. But actually, if the learning is driven by an actual patient, the learning is more powerful. The second factor was about where evidence came from. And if the evidence was supplied by the teacher, that didn't really encourage learning particularly. If the teacher guided somebody towards a particular piece of evidence, that was a bit better. But best of all was somebody who'd learnt some search strategies and was able to go out looking for their own evidence. And the third important dimension in Sackett's cube is critical appraisal skills. And that dimension considers somebody who looks at some evidence and has a hunch about it, pure intuition. That's okay, but better than that is somebody who is able to do a critical appraisal of the paper that they're looking at and think about the implications of that paper for practice. Best of all is somebody who is able to do critical reflection, thinking about the paper, thinking about its limitations, and able to apply it in practice. So the culmination of Sackett's cube is, in Sackett's view, the ideal learner who is empowered, who bases their learning on cases they've actually seen, is encouraged by the teacher, but actually is able to go searching for their own answers and is then able critically to appraise and apply lessons in real practice. So all of this leads on to the idea that if we are in an adult relationship, a guide by the side of the learner, encouraging them in their own journey, encouraging them as adult learners, we will really help them enormously.
Bloom's taxonomy is another helpful concept for curriculum planning.
Right at the beginning, I talked about the triangular relationship between the aims of an educational programme, the teaching methods and the assessments. And what Bloom said was that it was really important to make sure that the assessments and the aims were aligned. And one way of doing that was to look very carefully at the language that was used in describing the assessments. What Bloom did was that he looked at the cognitive domain and suggested at a very basic level you might have knowledge, simply knowing facts. The next stage beyond that is understanding those facts. That's about comprehension. The next stage above is about the application of knowledge in real life practice. The stages above this are higher order thinking, in which you're starting to analyse the understanding, the knowledge that you have, breaking it up into its component parts in order to get a really deep understanding of what's going on. You might take 2 different bits of knowledge from 2 different areas and synthesize them to come up with a new understanding. And you might be evaluating the knowledge that you have. What are its limitations? What are its advantages? What are its disadvantages? So in many senses, this was not described as a hierarchy, it was described as a taxonomy, but many people take it to be a hierarchy with higher order thinking towards the top layers or the top levels of Bloom's taxonomy. So just to make sense of this a little bit, I'm just thinking back to my father, who was unwell a few years ago. He had a massive stroke following the onset of an irregular heartbeat and atrial fibrillation. So if I was talking to a medical student about atrial fibrillation, I'd want them to know the causes of atrial fibrillation and to be able to tell me 2 or 3 important causes. That would be about knowledge. And also, in a sense, to understand how an irregular heartbeat can lead on to causing a stroke. So the formation of an embolus and why an embolus causes a stroke. And I might also want the medical student to think about the application of that knowledge in terms of when somebody might have a clot buster. However, when my father was admitted to hospital, he was assessed by a senior registrar in the hospital, and I would expect that registrar to know about the evidence for thrombolytic therapy in stroke. So I would hope that that person would have a good analysis of what's going on, would have analysed different papers, would be thinking about the advantages and disadvantages, and perhaps would be thinking about different forms of anticoagulation that could be used. So synthesising evidence from different areas and evaluating it. So I would hope that the person making a decision about whether to use a thrombolytic therapy would be using master's level, higher order thinking. The key thing here is to make sure that if you are aiming to assess higher order thinking, you don't have an assessment that simply says describe or understand. The language is important.
When setting assessments, there are specific verbs that should be used for each level. With knowledge, the trainee will be asked to describe, for comprehension, understand, application, demonstrate, analysis, explore, synthesis, integrate, and finally for evaluation, the trainee will be asked to evaluate.
So in summary, when thinking about curriculum planning, there are a number of important elements to include. One is that there should be a sense of direction, a sense of aim, a sense of purpose in an educational programme, and perhaps thinking about intended learning outcomes can be a useful way of doing so. But the curriculum is much more than the intended learning outcomes. Think about the black box and what's inside it. Think about the relationship between a teacher and a learner and invest your time in getting that relationship right. Some people would even say, look after the process and the outcomes will look after themselves. Finally, when designing assessments, make sure that your assessments match the aims for which they are designed.
Here are some questions that are intended to get you thinking about this subject in greater depth. To what extent do you agree with the views presented in this programme? What critical comments would you make about these ideas? A good starting point for further study is our e-learning module on setting learning objectives. Go to faculty.londondeanery.ac.uk/e-learning and select the topic from the left-hand panel. If you're a student on our postgraduate certificate course, you'll find references and suggestions for additional reading within the online resource folder.